And welcome back on this Thursday morning. Let's quickly go over that forecast. Feels quite cold out there. Grab a jacket on your way out. About 30 degrees already this morning. Things are going to warm up, though. We're going to see temperatures in the 50s, mid-50s today. Partly cloudy skies with hopefully a lot of sunshine out there. Tomorrow, though, 63 for that high, 42 for the low. And we've got 30% chance of rain on Saturday, 70% chance of rain on Sunday. So Sunday looks like definitely a rain day. All right, 230-4988, of course, gets Frank. And let's talk about the hospital for a little bit. All right, I've got Angie and Deb with me this morning. Good morning, ladies.
Good morning.
That was really nice because, you know, we thought that they were going to leave, but they've been laughing in here this morning, so it's gone quite well. But you said he's quite funny. Never a dull moment around here.
It's a great show.
Thank you, thank you. Are you ladies, are you both in the emergency room?
Yes.
And I wanted to hear some stories, but you guys said you couldn't share with me.
I guess I could share my first trauma patient.
How is it? Or, I mean, is it just...
A lady shot and killed her husband because he ate the last piece of fried chicken.
No.
That was my very first trauma patient.
And that's a true story.
That's a true story.
Wow. That sounds like some of the news things Jamie
She was
reads.
hungry.
I guess so. That's awful. But a lot of things a lot of things happen in the emergency room, I'm sure, and a lot of things you can't share with us because of that privacy thing. But, you know, I want to share at the time, my mother actually, we took her to the emergency room, and it was a Saturday morning. Walked in, and it was completely empty. And she's like, well, this is really odd for it to be empty like that. But it was a wonderful experience for us. Got us in, out, and fixed, and it was just wonderful. You know, you hear so many different stories about if you're here in Limestone County and you want to go to the Huntsville Hospital, you don't have to. Tell us some great things about Athens Hospital.
Well, in Athens, we...
I'm going to let you talk this hard.
We try to get our patients in and out very quickly, and we have a full staff, up to 8 nurses at one time, and we have sometimes up to 2 or 3 physicians and our nurse practitioners there to try to facilitate the patient flow and get people out as soon as we can.
Love the nurse practitioners. You know, sometimes the doctors are quite, you know, out of hand. You guys do a great job.
Thank you. We really enjoy doing what we do.
Yeah.
And what we do is to try to help facilitate getting patients through the ER in a timely manner so that, and it's a really cool job because when we can do that, it's a very fertile ground for patient satisfaction, and therefore we can teach the patient better about their illness or their plan of care, follow-up, those kinds of things.
Now, Debbie, you said you've been there for what, 2 years?
2 years, yes.
2 years. I imagine there is a ton of things. I mean, I want to hear some stories what you ladies see, but that was a good one about the, not a good one, but, you know, an odd story. But
Well, oftentimes, just, you know, random thoughts in a particular day. In this particular week, we've had several people who have had hemorrhages, brain hemorrhages, and we were able to transfer them because we aren't a specialty center, but we can refer, and we do that really well. The team that we were associated with called us back after our transfer and let us know that we had done a tremendous job. So,
do you ever have any patients that come back and just thank you later? Maybe they didn't have an opportunity to do it while they were there?
Absolutely.
We do.
Absolutely.
We've had one not long ago that suffered a heart attack, and he actually died in our hands, and we were able to resuscitate him. We transferred him to Huntsville, and he come back and thanked us for saving his life. So it's...
You guys are just like the angels behind the scene.
Well, if I fall out right here, y'all can save me, right?
Well,
we can do it. We'll do our best.
Well,
of course.
Of course.
Of course they do. They say stay over there.
how do you know somebody's having a heart attack?
What are some symptoms for, if anyone's watching, you know, everyone needs to know some symptoms of if you're having a heart attack. What are some things? You know, men are stubborn. They don't like to go to the hospital.
Actually, men and women have different signs and symptoms. Women usually are more stoic in their personality, and they'll suffer with it and really don't, you know, say a whole lot about it.
And something else, too, is that, and an education piece, which we like to do. An education piece is it depends on what part of the heart's affected as to what kind of symptom you may present with.
Yeah, I've heard people talk about that.
The lower part of the heart, you may have nausea and vomiting. The left side, depending on the arteries that are affected, oftentimes you hear about the jaw pain and the chest pain, pressure. And folks are pretty well attuned to chest pain.
Right.
Sometimes they ignore a pressure sensation.
You always hear it feels like an elephant's on my chest.
Yeah,
Right.
or just those vague, something isn't right in my chest. So those are things you really need to pay attention to. If you don't feel well, seek medical attention.
What is one of the hardest things that you guys have to witness? Is it when children are brought in? How do you guys keep your emotions out of your job? That's a big question.
Big question.
It really is. And
It's like we put up a wall sometimes when it gets very stressful. And, we might have a smile on our face, but deep down we're really torn up about what's going on.
Well, you guys keep your cool. You guys do great.
Thank you.
You're welcome. You're welcome. I see many of you, not many of you, not in the hospital that often, but when we would go by there and visit a lot of people, there's just so many hands that make everything work. So,
And that's the truth. We have a great staff, and our ancillary services are tremendously helpful. On our busiest days, everybody's helping everybody else, and it's just a really, really good
That's good.
situation. Yeah.
And nurse practitioners are not always female.
This is
They
true.
can be males as well.
This is true. We have several on staff, and we have several in the clinics around in the area too, and they're great, and their patients love them. The patients love us all, I think. So
Thank you for being with us this morning. And you know what? You got this Limestone Hospital. Can you take him with you? Maybe give him a checkup or something.
Hey, I've been to the hospital emergency room before.
Yes, you have.
Hey, I'm
Oh
going out
no! Whoa,
I forgot to tell my story.
Oh no! I thought we were going
Y'all
to.
work in the emergency room, right?
yes, that is correct. Yes.
I don't recall seeing them when we had to
No,
go.
you don't work there.
This was in 2006.
Was it that long ago?
Yes.
I have to,
Go.
this is a true story. It's on YouTube. You don't believe it. Listen up, Josie. You might learn something.
Oh goodness.
That morning, we're out at the river about 9 o'clock. Most of y'all can appreciate this. Y'all know what happened. I'm involved in a playtime with my wife.
Okay. Go.
I start screaming. Screaming. Killing. Get it. She said, how do we get to the hospital? I had to tell her. I had to get my clothes on. Rushed to the hospital. My blood pressure was, 190 over 200.
It was
or
horrible.
whatever.
Yes.
Face as red as a basket. They come in and says, what are you doing? I said, well, you having sex with your girlfriend? I said, well, both. My wife and my girlfriend.
I knew he was going to be fine. He was
They
cracking
come in
jokes.
and we called Dr. Alan Coleman, my dentist, Dr. Buddy, on the show here, and he comes down. He must be having an aneurysm, get in the hospital. So we walk in. About 2 hours later, get my blood pressure down. And take a wide shot, Brad. This is going to be a good story.
Spinal tap.
No, they said, well, you can go. So I go back out to the river, get on a golf cart. Luckily, there's a doctor from Decatur that's got a house right next to ours. He said, Jamie, you're an idiot. Call your doctor in Huntsville and get back to the hospital. We live in
Do some
Huntsville.
more checking.
Get out there, they got me around, and the
MRI.
doctor comes out and says, we're going to do a spinal tap on your husband. This comes back
Positive. We're going to do
negative, whatever the deal is.
Positive.
We're going to have to do brain surgery.
Like
Well, I'm laid out in there. John Dee's there, our preacher's there, her best friend's there. I might not make it. Y'all with me so far? Now, y'all may not treat a case like this,
laughing.
okay?
You must know.
You know what I'm about to say?
Stuff like that.
They come back 11 o'clock that night and say, Miss Cooper, your husband has had a postcoital migraine. Explain what that is.
Oh no.
Come on, Angela, you can do it. What is a postcoital migraine?
Oh, severe headache after you have sexual relations.
Exactly. Hallelujah. So, with that in mind, so I lived, obviously. We go to see a neurosurgeon. He says, Jamie, keep doing it. It's like riding a bicycle. Once you fall off, you get back on. Am I right? He says, we treat 1 or 2 a month.
Once a month, I get a patient that comes. He's either 40 or above. He's having sex with a girlfriend, gets too excited, and if you're not healthy, it causes a stroke or a heart attack. So he's healthy. It was just
Is that the way it happens?
That's the way it
Do y'all ever
happens.
treat people like that, or am I the only one that's ever been in Athens Hospital for that?
No, I've actually treated some.